how to keep teeth that are on the brink, meaning that actually have to be extracted pain-free, safely and predictably by means of a professionally performed root canal treatment. At the same time, this can avoid immense costs for dentures or implants. Hello and welcome to the Advice Studio. Today's topic is root canal treatment. For this purpose we have a special expert as our guest, Dr. Elmar Jung, holistic integrative dentist, health coach, author and podcaster. Hello Dr. Jung, nice to have you here.
Hello Birgit, it's a pleasure to be here. Thank you for the invite.
Dr. Jung, before we get to our actual topic, we should explain what exactly we are talking about. Can you please describe to our viewers what exactly a root canal treatment is?
Well, a root canal treatment is an option to save the tooth from extraction. And for a root canal treatment, what we need to do is to go into the tooth and remove the inner part, the tissue from the root canal, which is the nerves, the blood vessels, the lymph vessels. So when we do a root canal, we actually strip the root of the connection to the nerves, to the blood supply and to the lymph supply, which means the tooth is actually hollow and it will be weakened over time. Then once the tissue is removed, the dentist will clean the tooth, will widen the root canal and will disinfect the root canal. Afterwards, he puts in a filling to really seal the root canal. And nowadays, with the microscopes, he can do a very, very good job to go in very small areas. However, there's agreement that a tooth canal can never be sterilized because there are so many tiny little roots, tiny little channels. The treatments from the disinfection doesn't reach. And so, therefore, the tooth will always harbor infection, always harbor bacteria. So in a way, it's a brilliant theory. However, we need to see who actually can have root canal treated teeth, because that depends on their overall health and their immune system.
Okay, before we get to the filling of the root canal, I would like to know why someone needs a root canal treatment in the first place.
Well, the main reason why people need root canals is pain. So a root canal treatment is normally, we can almost say it's an emergency treatment to get people out of pain, because if someone already has experienced root treatment and the pain it came with before that, they really know what excruciating pain that can be. And so, therefore, what the dentist is then doing, he removes the nerve so that the pain goes. That is one reason, pain, for the necessity for a root canal treatment. Then obviously the tooth can also decay, and you not necessarily feel anything when a tooth decays, but the dentist can see it, and oftentimes then on the X-ray that the dentist takes, he will also be able to show you how deep that decay goes. And oftentimes the decay goes to the nerve, which means that there's only two options again, extraction or the root canal treatment. And so then that could lead to a root canal treatment when the tooth is too decayed. Then sometimes it also happens from trauma. Let's say you play rugby, you get a hit on the front teeth, the teeth get damaged. And so, therefore, the teeth then need to be root canal treated so that you can keep the teeth in place. And there's also, quite interestingly, a school of thought, I think it's from Italy, that's where I heard it first about 20 years ago. They do it as a preventative measure, which is kind of rather interesting, to put it that way, because they say, before we do crowns, before we do any bridge work, any restorative work, we remove the nerve so that at least the patient will not have any pain after our treatment. Is quite a controversial way of thinking, but it is a school of thought. I wouldn't agree with it, because that doesn't give the tooth the chance to go safely and alive. through life.
This seems to be a very elaborate procedure. Once the root canals are cleaned, what happens next?
Well, once the tooth canal is cleaned and filled, then still there are bacteria left, and also the sealant of the root canal can sometimes not be as sealed and it can leak. So there are always bacteria left, and we need to regularly look at the tooth. Now, the main reason why we did the root canal and what we need to check if the root canal was a success is the pain gone? Are there any symptoms? Does the X-ray show that it is now getting better? And we can see that over months and years that a abscess, for example, from a root canal does actually get better. We also need to see that with those bacteria left, there's always a challenge for your immune system. And there's also a challenge for the dentist who does the root canal, because when we look at the anatomy of the teeth, then we know exactly that it cannot be clean, disinfected, let alone sterilized, because there are 2 or 3 miles of tiny little channels that are in the tooth. And so it's not possible to fill those or even disinfect these kind of channels, which are ideal hiding places for the bacteria and their exotoxins that they produce.
Oh, that doesn't sound so good. Does it mean that root canals can be bad for us? Can they cause problems that last a lifetime, or can they be avoided in the first place?
Well, the problems from root canals, yes, they can be avoided if you do an extraction. Then you don't have the side effects of a root canal, of course. But when we talk about the root canal itself, then we also need to look at the entire person, at his health, at his overall health. Is it a patient who actually suffers multiple other chronic diseases? And so if his immune system is already compromised, then obviously we need to see that in a different light than when we do a root canal with a healthy person. And again, with the bacteria left, is the body, the immune system, capable of dealing with that? Can it deal with all the endotoxins? And despite using ozones, laser and microscopes, there's still the problem that they can't reach everywhere. And even if the ozone would reach all the areas, then once you stop the ozone treatment, bacteria come back and they will do harm then if the body allows that to do. And we know from research that root canal treated tooth is a source of chronic inflammation and infection. It's a dead organ in your body, and funnily enough, dentistry is the only department in medicine where you leave a dead body in the body and think that's okay.
Okay, so a root canal is not the smartest idea. But how can the dentist find out if the tooth is dead, infected or toxic? What methods are there to taste it?
Well, the first test that a dentist is doing is to check whether the tooth is actually dead or is still alive with a cold test. So he takes the cold test and performs the test at different teeth to see whether they react to the cold, and then the tooth in question, whether this one tests to the cold, reacts to the cold. And there's also a test that is called orotox, which we use when the tooth is actually dead, to see how many of these sulfur compounds are coming out of the tooth. And the orotox can do that test very quickly. Within a 5 or 10 minutes time, we can see that. Then obviously the X-ray shows us a lot of signs whether the abscess that was the first reason for the root canal to be needed, has the abscess gone back? Has this gotten smaller? Is it shrinking? And we have also the cavital scan, which is a fantastic method of scanning jawbone density. So when we scan a root canal treatment and we see on the cavital scan that there is a reduced bone density, then we know that this kind of inflammation coming from the root canal treated tooth has actually already affected the tooth around the root canal treated tooth, so that the bone has actually suffered already.
There are any alternatives? Can I avoid a root canal treatment?
Well, the only real alternative to root canal treatment is an extraction. Other alternatives would be if there is an abscess. A lot of dentists start with giving antibiotics, and you could just leave it and see what happens. Now, neither of those are really causative treatments, because you want to go to the root cause, which is the infected nerve. And so you need to treat the nerve, you need to remove the nerve, and therefore take the nerve and all these tissues out. Now, to not be in the position to need a root canal, you can do a lot of things which we call prevention. That means lifestyle changes, changes in your diet, changes in your oral hygiene, so that your body is really balanced and can cope with little issues, so that you don't get tooth decay, that you don't have an infected tooth. And obviously there's always the odd accident, the trauma that happens, where then the root canal or the extraction are the two options that you can choose from.
Thank you very much, Dr. Jung. Can you please summarize the 3 most important facts about root canal treatments for our viewers?
Well, the main thing that we really need to keep in mind is that a root canal cannot be sterilized. It's impossible due to the anatomy of the tooth. So no matter how good the equipment of the dentist is, it is or has gotten much, much better over the years, and you can do much better root canal treatments. However, you will not be able to sterilize the tooth, which means, secondly, that you always have a toxic load in your root canal treated tooth. And that means that these can cause systemic effects. And those systemic effects then need to be dealt with by your immune system. Now, that is the reason why we need to see how does the root canal affect that person. Has he got more underlying health issues? And there's also the tooth-organ connection, where we can see what kind of combination or coordination there is between a tooth and an organ, and that can suffer. And with the tooth-organ connection, there are also emotions involved, which need to be looked at. So it's not just this one tooth. We, as holistic dentists, really need to look at the overall picture. What does the patient present? How is he in his overall health? And then make the decision whether a root canal is actually an issue for him, or he can, at the moment, get on with it and can really cope with that. It's not that the body asks for root canals, but can the body deal with it? Can it compensate the root canal?
Perfect. One last question. Where can our viewers get more information for this topic?
Well, the best place to get more information is probably my podcast, Elmar's Tooth Talk, the missing link to total health. And there we have episodes 6 and 7 is, yes, I think 6 and 7. They are all about root canal fillings. There's also a frequently asked questions website part, where you can read about root canals and the questions we got asked by our patients. And then there's this fantastic little book, Shut Your Mouth and Open Wide, which gives all the information in a very concise way. And that's a really good approach to your dental health. So, yeah, my website is drelmarjung.com, and I look forward to seeing you there.
Thank you very much, Dr. Jung, for being here.
You're very welcome.
And for our viewers, thank you very much, and we say goodbye.